Welcome back. In this video, we'll review the guidelines for when to order CT after head or neck trauma. CT is effective to notice the small serious changes that occur after trauma, but it's very resource intensive. And that's why we developed guidelines to tell us whether or not we should use CT. You should order CT if the trauma was high energy mechanism. For example, if there was a car accident and somebody is ejected from the car, or if somebody fell from building 3 floors high, or if they were hit with a metal object in their head. You should also order CT if there was any neurological symptoms. For example, if somebody had head trauma and then they start having tingling in their tongue or weakness in one of their limbs, you should order CT. If there was tenderness along the spine, and in this case you should order CT of the head, neck, and entire spinal cord. If the patient was intoxicated when the injury occurred, as this can mask the effects of neurological symptoms, and we cannot risk having an injury that the patient cannot recognize. If there was altered mental status, and this is very important because mental status is the first thing that will be affected if neurological damage is imminent. And most importantly, you should order CT if there was other distracting injuries. For example, if somebody fell off the stairs and then they presented to the ER and they had a broken femur, the patient will be screaming in agony because their femur is broken, and this could distract you from checking the brain. So in this case, order head and neck CT first. And that's all I have. Hopefully this helps, and thank you so much for watching.